Housing lender.
It's open enrollment season, and MediShare is a Christian healthcare sharing ministry that saves most families about $500 a month. Google MediShare and see if it is a fit for you.
Let's check our roads this morning in the Team Hochberg Traffic Center with Jim Talamonte.
Through some lingering fog, we've had no shortage of collisions this morning. Right now, we're looking at a crash in Niles at the intersection of Oakton and Caldwell. There is also a collision on the inbound Eisenhower at the exit ramp to North Avenue. At the bottom of that ramp, there's a rollover box truck. The ramp is still open, heading to eastbound North Avenue, but expect a bit of a holdup there. On the outbound side, got a collision on the Ike at Mill Road that just cleared out of the way. The delays begin around 83. It's 36 minutes from downtown Chicago to 390. Inbound 33 minutes. Traffic's heavy on the extension approaching Mill, and also a little bit tight approaching the Burns Circle. That's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next. Your official Chicagoland weather forecast from our 1-hour heating and air conditioning weather center. Cloudy, breezy this afternoon. A shower or thunderstorm could hang around, and some of those storms could be severe. A high near 70. 51 at O'Hare, 51 Lakefront, 55 at Midway. Your next news update is at 8 with breaking news as it happens. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy on Meet the Press over the weekend. That yapping terrier, Chuck Todd, again featured Dr. Michael Osterholm. He is a Center for Infectious Disease Research and Policy at the University of Minnesota. And we're efforting to get him on the show, too, because we want to hear from experts, doctors, public health professionals across the spectrum who have different views, and sometimes different views of the same data. And sometimes sometimes agreement on the data and different views what the data implicates. So unlike, say, a lot of these politicians, say, I don't know, a particular governor who has the same waist and inseam as Kim Jong-un,
Hey now.
Perhaps comparing the opinions and the information that he's receiving as he falls into the Ionitis trap, as I'm calling it now. Not believing the real data, believing my models.
Right. And one of the models, remember we had her on the show from University of Chicago who said, well, we should be on lockdown indefinitely? That's not an answer.
That's one of his modelers. That's right.
That's one of the modelers that he's using.
And by the way, just on that score, as we see cases spike in Africa, Dr. Scott Gottlieb tweeted about that, former FDA commissioner. Okay, let me ask you a question, all you Zeke Emanuel acolytes out there. Have you been listening to David Beasley, the head of the World Food Program? We played his remarks on this program. He's talking about famines of biblical proportion because of supply web problems, because of closed borders, because of resources shortfall. So lives for lives. He's talking about 300,000 people a day for months in the not-too-distant future if some of the problems he sees with the work that he oversees are not fixed. So again, lives versus lives. And again, you cannot have a strong public health system if you don't have a strong economy. How is what we're doing in the West putting us in a position to help people in Africa, for example? A question I would put to all those who suggest that all these draconian measures are because they're servant leaders and they're other regarding. Well, there are people that are other regarding and servant leaders who disagree with the policy choices being made. That's the point. So to Osterholm, he said a couple of things that are worth noting, and we've got medical professionals coming on, so I'd like to get their opinion. But first, let's set them up with what he said. One of the things is what we need to do essentially to get to herd immunity, or how that would happen. What's the threshold? And he put a percentage on it. Other doctors we've talked to, microbiologists we've talked to, there's no exact percentage. Andrew Bogan, who was co-author of the Santa Clara antibody study, as well as others, have said that. But Osterholm feels confident giving a range.
Yeah.
Well, first of all, let's just take the numbers. At most, 5 to 15% of the United States has been infected to date. With all the experience we've had so far, this virus is going to keep transmitting. It's going to keep trying to find humans to do what it does until we get at least 60 or 70% of the people infected. That's what it'll take to get herd immunity. You know, Chuck, we're in the very earliest days of this situation right now. You know, if I could just briefly say one story here. Right after 9/11, I spent a number of days up at your studios doing filming around the issue of what was happening. And the predecessor here, the late Tim Russert, used to say to me all the time, "Hi, Doc, how you doing? Is the big one here yet?" And I would always say, "No, Tim, it's not." If he asked me today, "Is the big one here? Is it coming?" I would say, "Tim, this is the big one. And it's going to be here for the next 16 to 18 months. And people don't get that yet. We're just on the very first stages. When I hear New York talking about the fact they're down on the backside of the mountain, I know they've been through hell. And that's an important statement. But they have to understand that's not the mountain, that's the foothills. They have mountains to go yet. We have a lot of people to get infected before this is over.
That may be true, but that's why the question of lethality rate is the germane one, and hospitalization rate too, because we have tens of millions of flu cases and hospitalizations and tens of thousands of deaths every year too. This is why lethality and the data we have versus what the models were predicting is such a critical discussion. The one other thing he said that's notable is about the question whether or not after you've been infected, do you develop an immunity, and he referenced some animal research that's promising.
The statement that came out yesterday from the World Health Organization suggesting there may not be immunity was misinterpreted to mean that we don't have evidence today that you are protected from humans. But we have actually animal model data, monkeys that have been infected intentionally and then re-challenged that were protected. We have a new study on Friday that said vaccine protected them. So I think we're going to have it. I just don't think it's going to be soon.
And the World Health Organization walked that back a little bit, saying you do have immunity, but we don't know for how long.
For more on these topics and more, we're pleased to be joined by Adam Hardage. He's the CEO and co-founder of Remote Health Solutions, and Dr. Jon Baugh. He's an emergency room doctor and the chief medical officer and co-founder of Remote Health Solutions. Adam and Dr. Jon, not the musician, rest in peace. Thanks for joining us. Appreciate it.
Yeah, thanks for having us. Appreciate it.
So whoever wants to take this jump ball, let's start with this herd immunity. Assuming that we'll get to herd immunity before we get to a vaccine, if it's 12 to 18 months, to the extent that even manifests itself, is that right? That threshold, is that the target that we're looking for, or is there such a thing as a target?
I'll take that.
Doc, take that one.
So this is Dr. Baugh, this is Jon Baugh. So we are looking for that herd immunity. The problem is, like has been mentioned, is we're not quite sure what that number needs to be. And unfortunately, until we get some widespread antibody testing, we're not even going to know how much of our community has been infected already and has recovered. I think there's a little bit of a misinterpretation when we look at that data from the WHO about, they initially came out and said that there doesn't appear to be any evidence that we are gaining immunity. I think that was a little bit misinterpreted, the data both by them and from them, because we know, in fact, if you look at their data, we know that we gain immunity against viruses by getting infected and then recovering. They're just not quite sure how long that's going to last. But we know even with other coronaviruses that we gain that immunity, and that's really how our societies, how our communities are going to be protected this fall and in the future. Now, we may not have that immunity last for more than a season, but we know that it should at least give us seasonal protection and seasonal immunity. And the key really is going to be some herd immunity, because then it doesn't go from person to person, because you've already got a surrounding percentage of you that's already been infected and has already recovered. And so that person's not going to spread it to others.
Well, Doctor,
Now,
how reliable?
We also know.
How reliable are the antibody testings? Because, there's some that do a
Right.
pinprick, and I took one the other day, and they drew, a vial of blood and sent off to Quest Diagnostic, and they said that they're reliable and that the pinpricks are not.
Yeah. Right now, we're not sure, and that's part of the problem. It's even the reliability of our antibody testing is being called into question right now, based upon the fact that a lot of this is coming forth so rapidly, because we're really trying to make a difference. So, and it's difficult to be able to say which ones right now are the most effective and which ones are not. And it doesn't necessarily mean the amount of blood that's taken, because if you get the antibodies and you're able to test them off of a small amount of blood, a pinprick test, then that's great. It's a matter of the underlying test itself rather than the amount of blood.
What about this idea from a paper that I read from a couple of economists and epidemiologists? The idea of early detection of super spreaders. They're talking about mass group testing to early identify super spreaders. The model, here we go, but nonetheless, applied to real COVID-19 dynamics in London, Moscow, and New York City. The upshot is the findings are that the top 10% of spreaders transmit 45% of the new cases, and so they argue rapid isolation of super spreaders leads to a 4 to 8-fold mitigation of the pandemic, depending on the quarantine strength, amount of currently infected people, and other variables. What about that? What about we're trying to zero in on those doing the disproportionate share of the spreading?
Yeah. So that is very important, not only for in the future as we look at the recurrence or the reemergence of COVID-19, but also for us to be able to get back to a normal society. Because if we can isolate individuals rather than communities, then we can really make a big difference in what's going on with our economy and our community, and also the rapid spread. If as we isolate those super spreaders, those who are most easily transmit the virus, and we isolate them instead, as we talk about with our company, with Remote Health Solutions, using technology to keep them home and away from the others, and still be able to keep a very close medical eye on them, and allow them to be not the source of further spread as we try to open up our society, and then as we try to keep it open later in the fall. And that's really, I do agree, that's one of the keys that we've talked about a lot.
Just in terms of first principles here, best practices, immunology 101, if you will, are we supposed to quarantine healthy people or just sick people?
Well, I'll say this. This is a really, truly unprecedented time. We hear that a lot in this scenario. I think that the first idea as we moved into this, the idea of quarantining or isolating healthy individuals as well as sick individuals was important as we move forward. I think we are isolating maybe some healthy individuals who are at very high risk, but then really we're isolating those who are sick and those who spread the disease, and we let the rest of the healthy individuals get back to work and get back to taking care of their families. We really just can't maintain what we're doing and expect families to move forward and survive in the way that we know that they need to.
And children are pretty immune from this. I mean, I know some have it, but the mortality rate is fairly low to even non-existent in some states.
Yeah.
So why not have them go back to school?
Yeah, it is. Now, the reason for that obviously is the spread, because they take that home to grandma and grandpa, which really have that high lethality, that high mortality rate. But you're exactly right. It's actually been sort of an odd thing for us to be able to look at with the spread between kids and then the lack of mortality from children. We initially thought that this was going to be affecting the very old and the very young, and now we have pediatric intensive care units, PICUs, sitting empty, and we have had during this whole pandemic. It just doesn't seem to affect the kids very much, but we do know that they do spread it. They can catch the virus and then spread it rapidly. So that's the reason, that's the logic, that's the mentality. As we start moving forward, though, and we're able to isolate individuals rather than communities, we are hopefully going to be able to get my kids back to school and get them in a position where they can continue to grow and learn and thrive.
I mean, does that mentality make sense? Because I know that's what's been said. Give it to grandma and grandpa. And I know there are housing situations where grandma and or grandpa live with mom and dad and the kids, but that's a small percentage of the housing situations. Number one, number two, there's it's even smaller when you start to think about, well, can other accommodations be made if you have to care give to a senior citizen, to somebody elderly in these times, because otherwise you're talking about parents that are largely under 50 with grammar school and high school kids, and they're going to be living together anyway. So this whole kids can't go back to school because they're going to come home and give it to grandma and grandpa just strikes me as something that is a happy untruth.
I'll say that's a really tough situation, tough scenario, because the strict isolation that we implemented and tried to build to show promise with was we think very helpful. I think that we really did flatten the curve. Was it all necessary? It's hard to know. I mean, that's the truth. It's hard to know.
Yeah.
If we implemented things earlier, would it have helped? Maybe. If we didn't implement such strict measures, would it have mattered? It's hard to know. We're looking back now saying, did we do too much or we did not do enough early enough? And we're going to analyze this for years. We're going to be looking at data for a long, long time to be able to figure out what was the real benefit and what could we have done better.
No doubt.
We're going to be analyzing this for a long time.
No doubt. But I mean, there are decisions that need to be made in real time, as you obviously understand, and as you were pointing to. And I mean, we do have, thankfully, as it turns out, what Sweden is doing and what Sweden has done. And we find that Sweden, basically, with kids in school and businesses open, some isolation, but as you say, more with respect to vulnerable people rather than everybody. They're doing better than the states in this country that have the greatest outbreak, and they're about the middle of the pack in Europe. And they say, their epidemiologists say, they're approaching herd immunity.
This is Adam jumping in. I'll just say that, the same thing I've been saying since we started looking at this as a company in early January. I think we were one of the first companies. I mean, we were up on Capitol Hill by mid-January, beating the drum, trying to say, hey, this thing is going to be serious and this is a real problem. And also the same thing I was saying back then, and it's not the fire in the theater that kills everybody. It's a stampede for the exit. And I fear, so back in the military days, I was a military guy for a long time, and we used to talk about second and third order effects. So in other words, it's not just the act that you do, whether it's, taking out a terrorist or something like that, but it's the follow-on knock-on effects that have issues. And I see parallels to this in a big way, because if you disable the global supply chain and economy, which we've in essence done, biggest experiment in all of human history doing that. It's like I call it 2020, the year that people just quit. I think that the knock-on effects we haven't even started to see yet, and I think it gets scary when you start talking about things that are creeping up now, like food shortages, and that leads to civil unrest. Civil unrest leads to, martial law leads to revolution. This is the road that we've started to go down. So I think it's time to start opening responsibly, because you cannot ask the world to just stop, because people at the end of the day have to trade. They've got to put food on the table for their families.
Well,
I think it's irresponsible.
And just to your point, I mean, going back to Dr. Osterholm, saying, New York is still in the foothills. They haven't summited the mountain yet. Well, that may be true, because at the end of the day, a year from now, you may have tens of millions of Americans that have been infected. But it's the lethality rate that's the issue. And so where does that lead based on the philosophy that we've taken to this point, which is shut down until you can be sure that you've eliminated the transmission of the virus, which is just utopian nonsense.
It is. It is absolutely utopian nonsense. It's ironic that sometimes in combat people get shot. And I equate this to combat, because it very much is that, and you have to be able to, what we have done, especially we're guilty of this in America in a big way, and that is advocate personal responsibility. We have fallen prey to the nanny state type idea. The individual is no longer, responsible for their own lives, decisions, everything else. The instant gratification world, well, all that's going away and is changing. And I think, people need to look around and assess what is the most important thing and make the most important thing the most important thing. And in that case, like for me, I'm a mid-40s father of two, and, it's protecting my family and growing my business if I can, or at least keeping that business alive through this, and keeping our employees on the payroll so that they can feed their families. So we're running like hell trying to, make sure that we're kind of ahead of this tidal wave or whatever it is, unemployment and everything else. And so we've been fortunate enough to date at Remote Health Solutions that we haven't had to lay anybody off. In fact, we're hoping to be able to hire some people this year as we're helping with the coronavirus fight. And the way that we do that is by leveraging technology to keep the patient and the potentially infected separate from each other, and the doctors and the care team safe.
We're going to have to leave. We're going to have to leave it there. I'm sorry. Adam Hardage, CEO and co-founder of Remote Health Solutions. Dr. Jon Baugh, emergency room doctor, chief medical officer, and co-founder of Remote Health Solutions. With the fabulous Bakersfield boys being deplatformed by YouTube, you guys may be able to fill in, be the new stars, the new YouTube stars. Adam and Dr. Jon, thanks so much for joining us. Appreciate it.
Thank you, Dan. Thanks for having us on.
Thanks. And they joined us on our turnkey.pro answer line. Coming up on Chicago's Morning Answer.
Lyman Stone on lockdowns at 8:08.
But now let's head straight into that newsroom. Here is